Special attention to the eyes is a frequent requirement in the care of patients who have sustained deep second-degree or third-degree burns of the face. Although the eyes themselves are rarely burned, serious eye damage secondary to burns of the eyelids and tissues surrounding the eyes can readily occur. The chief dangers are from infection, resulting in chronic conjunctivitis, and from corneal ulceration, resulting in permanent visual damage. Infection is caused by the constant entrance into the eye of bacteria from contaminated burned tissues adjacent to the eye. Corneal ulceration occurs indirectly as healing of the eyelids and surrounding tissues takes place, and scar tissue contracture causing eversion or ectropion of the upper or lower eyelids prevents complete closure of the eyes. The cornea is then exposed to drying as tears spill out over the margin of the averted eyelid. Drying of the cornea, in turn, leads to corneal ulceration. Ectropion of the eyelid is corrected surgically by grafting, blepharophy, or tarsorrhaphy. Irrigations, installations of liquid medications, and applications of bland ointments are measures which are frequently employed to control infection and prevent drying of the cornea prior to and following corrective surgery. Equipment used for eye irrigation and application of eye ointment are sterile. The irrigation tray contains 1 hand towel, 1 pair of rubber gloves, 1 bulb syringe, 1 solution basin, several 4x4 gauze sponges, several 2x2 gauze sponges, several cotton-tipped applicators. Usually, normal saline is the solution used for irrigation. Other items needed are ointment, as prescribed by the physician, and a paper bag for waste. The nursing care of patients with burns involving the eyes is extremely important. It includes being alert to significant signs and symptoms, such as the presence in the eye of exudate and/or adherent specks, redness and/or congestion of the eye, sleeping with the eyes partly open, complaints of blurring of vision, burning or stinging, scratchiness or dryness. Nursing care must also include giving emotional support to the anxious patient and to his equally anxious relatives during the early post-burn period, when his eyes are tightly shut from edema, or following reparative surgery, and protecting patients from acts of their own, which might interfere with treatment or cause further injury. Such acts include rubbing his eyes, removing eye dressings, or disturbing eye sutures, displacing an intravenous or urinary catheter, or a nasogastric tube, attempting to get out of bed. Unless someone can be with the patient constantly to protect him from these dangers, it is usually necessary to restrain the patient's hands and/or legs. When restraints are necessary, permission to use them must be obtained from the physician and applied carefully to avoid additional trauma. Before applying a restraint, the nurse must explain to the lucid patient why he must be restrained. Unless this is done, his anxiety will be increased, particularly if his eyes are closed by edema or following reparative surgery. Finally, the nurse faithfully carries out eye care as directed by the physician. Before beginning an eye irrigation or other eye treatment, the nurse carefully washes her hands. Fingernails must be short and thoroughly clean. After washing her hands, the nurse explains the irrigation procedure to the patient. She places a sterile towel over the patient's shoulder and then carefully checks the label of the flask containing the irrigating solution to be sure that the proper solution is used for the proper patient. She pours the solution into the sponge bowl. Care is taken to avoid contamination of cap and neck of the flask. Next, she puts on sterile gloves. She then moistens several cotton-tipped applicators. And gently removes discharges from the corner and margins of the patient's eye. This is done as a precaution against flushing material into the patient's eye while it's being irrigated. Next, she draws solution up into the bulb syringe and places folded 4x4 sponges at the outer angle of the patient's eye, above the ear, to catch the return flow of solution, preventing the solution, insofar as is possible, from entering the patient's ear. Gauze sponges are used for this purpose rather than a curved basin, because the edge of the basin might cause further trauma to the patient's face. The flow of solution is gently directed from the inner to the outer aspect of the eye. After irrigating the eye, the nurse gently blots the eyelids with 2x2 gauze sponges. 4x4 sponges are used to blot the patient's face. After drying the patient's face, the nurse prepares to apply the ointment to the patient's eyes. She checks the container to be sure it matches the order on the chart. She then gently draws down the lower lid and instructs the patient to look up as she applies a thin ribbon of ointment into the pocket of the lower lid. She then instructs the patient to gently close his eye and roll his eye, so that the ointment is spread over the whole conjunctival sac. Upon completion of the procedure, the towel is removed from the patient's shoulder, and gauze sponges, applicators, and other such items used for the irrigation are disposed of. Other equipment is taken to the workroom and is cleaned and processed according to established ward policy. After cleaning the equipment, the nurse records the treatment on the appropriate medical record. An entry is made of any unfavorable sign or symptom noted by the nurse while irrigating the patient's eyes. Unfavorable signs or symptoms are also brought to the attention of the physician. After talking with the nurse, the doctor checks the patient's eyes. In treating burns involving the eyes, therapy is directed toward preventing infection and corneal ulceration. Good nursing care is extremely important. It includes being alert to significant signs and symptoms, protecting the patient from acts of his own, which might interfere with treatment or cause further injury, faithfully carrying out eye care as directed by the physician, and giving emotional support to the anxious patient and his equally anxious relatives.